So let's embark on this journey to healthier hair together. Common questions asked are, what is hair fall and why does it matter? Now, basics of what we need to understand is that hair fall happens when we start losing hair in excess of what we normally lose. So if it goes beyond the extent of 50 to 100 hairs per day, and we start feeling that our scalp is showing, we can see our scalp line, and we are seeing a widening in our hair between our hair follicles, that means we are suffering from hair fall. Now, what are the causes? There are multiple causes for hair fall. We need to go into a lot of them. One of them is genetic, which we see in patients with male pattern baldness. Then we have stress-induced, dietary deficiencies. A lot of diseases like thyroid and weight loss also cause hair fall. In today's day and age, COVID has become a very important reason why we lose hair. And we find that other causes like excessive bleeding, dengue, jaundice, chikungunya, typhoid, anything which impacts our internal milieu causes us to lose hair 3 months post the disease. Not to forget pregnancy. Even post-pregnancy, we find that 3 months post-pregnancy, a lot of us experience hair fall. So I've just enumerated a small amount of reasons. Dietary intake, when it goes down, a lot of children are doing a lot of dietary programs and dieting issues. That also causes a loss of hair 3 months post starting of the diet programs. So now we need to see what is the role of diet in hair health. We can never underplay the role of diet. We have to make sure that we have a very balanced diet. Not only do we need proteins, minerals, vitamins, fat, carbs, everything should be in the right proportion so that we don't lose hair. Vitamin D, iron, these are minerals which we find that most patients are deficient, especially in ladies and girls. So we need to keep that in our mind, get these tests done and accordingly treat them as and when it happens. So you'll find that vitamins like vitamin D, minerals which contain zinc, folic acid, iron tablets, all added to our normal diet in external or internally, will help us to grow back hair. When we come to the topical treatments, those are treatments which we give to patients who are undergoing a hair fall problem. There are a lot of products available. Of course, it has to be done under medical supervision. So you need to go. We have protein products which contain Capexil, Redensil, caffeine, then we have minoxidil, which is the gold standard of treatment for hair fall. But of course, this has to be done under medical supervision. Along with this, we need to add, of course, our supplements of vitamins and minerals according to what the patient requires. For this, we do a lot of investigations also before we start the treatment so that we know what we are treating. We should not underplay the role of hypothyroidism. We've not spoken of that earlier, but that's one of the reasons why we lose hair. So patients with hypothyroid need to take oral medicines for thyroid also. Lifestyle impact, there's influence of stress. As I said, we cannot underplay the reason of stress. Stress is one of the main reasons why we lose hair. We need to make sure that we keep exercises and our mental health in order. Then we have other treatments like oral minoxidil now is given orally. We have procedures which are done to bring back hair, we have the lasers, we have transplants, we have PRP. So these are all other techniques which are added so that we can add to our armamentarium of the treatment of hair fall. So this kind of covers what we all need to do during our treatment modalities. And along with this, of course, I would never stop in highlighting that whatever we need to do has to be done with a medical supervision. You need to meet your dermatologist, find out the cause of your disease, and then treat it. So I hope this has been able to give you an overview of what you need. Any other help, you're most welcome to go onto the site Dermavidya and clear up your doubts further.
For more such videos, visit or log into dermavidya.com.